The team and I, we performed a systematic review and a meta-analysis while addressing the topic you just mentioned. Well, why we decided to make this research project is because there's like the literature and evidence showed that a restrictive transfusion policy is better for different pathologies and different diseases, but the hematological population has been almost always excluded from this analysis and from randomized trials. So we found that there's this big gap in the knowledge for this specific population. So that's why we decided to make this project. Well, so basically what the talk is going to be about, it's just describing what we did. So a systematic review and meta-analysis. We searched for different studies and different literature in mainly three bases, which were PubMed, which is Medline, of course. We searched also in the Cochrane Library, and we searched in Embase for a total of more than 13,000 studies. So we really did a very big search because we wanted to try and include everything, like as many papers and reviews as possible. And after just doing like the final triage process, we included 8 studies, which were 2 randomized trials and 6 observational studies. Basically, our conclusions, after we did the statistical analysis, the forest plots, and the pooled analysis, our conclusions is basically that the single unit transfusion strategy, which is the restrictive transfusion strategy, lowers hemoglobin levels at the time of discharge, but it also reduces the number of units, the number of blood units that are required for these patients. However, we found no significant difference in bleeding, mortality, or length of hospital stay. I think, for example, one question that I think this particular study raises is what happens when this specific population is discharged with a lower hemoglobin levels? Because we found different cohort studies, even randomized trials, that showed that there are some adverse events or even the risk of just re-entering hospitalization increases when a patient is discharged with lower hemoglobin levels. But again, there are no studies that address this question in this specific population of patients with hematological conditions that are either receiving chemotherapy or stem transplantation. So I think it would be a great question to perhaps do more prospective cohorts or randomized trials, because it's really an unanswered question right now.